Hello everyone, my name is David Barrios and my Teach 1 assignment is about precision and predictive medicine for class HAP-360 at George Mason University. The objectives of the assignment are to obtain knowledge about precision and predictive medicine and to apply this knowledge by analyzing patients' response to treatment. The first question we need to answer in the Do 1 assignment is to create a table showing the relationship between anxiety diagnosis and response to citalopram. We will then report the rate of success for citalopram among patients with generalized anxiety depression. Before we begin, we are going to open up the Excel document from Blackboard. Once opened up, you will see the data presented on the spreadsheet. To get us started, we will click the Insert tab on the top, followed by clicking Pivot Table and then hit OK. By adding the pivot table, we are able to calculate the rate of success by generalized anxiety diagnosis. After adding the pivot table, go all the way to the right and either search or scroll for generalized anxiety diagnosis. Once you've found it, click then drag generalized anxiety diagnosis into the box that says rows. And you should now see it added to the table. Then either search or scroll to find CIT success and click and drag it to both columns and values. At the bottom of the values box, it says sum, and what we want to do is change it to count. By doing so, click on the info button and select count under the sum and press OK. Now that we have the necessary data, we can calculate the success rate of citalopram. In order to do this, we need to enter equals C7 divided by D7. From there, we get the success rate of citalopram among people with generalized anxiety depression. Question 2 states which medication has the highest success rate when the patient has anxiety diagnosis. So report the rate of success for each of the medications. Give your opinion about why it is difficult to understand which medication works for patients with generalized anxiety depression. For question 2, we will be using the same spreadsheet to follow the steps from question 1, but now exchange CIT for BUP in both columns and values. Keep the rows value the same. Then find the success rate and create a chart and be able to include all of the medications and their success rates. The second part of the question is to give your opinion on why it is difficult to understand which medication works. So every patient is different, which means that there will be a different reaction to different medications taken. The success rate takes all the patients and combines them, and that precision medicine suggests against this and towards looking at each patient individually. So question 3 is, which medication has the highest success rate when the patient has substance abuse? In order to answer question 3, we'll refer back to question 2, repeating the pivot value chart for each medication, but then this time we will change the row to drug abuse diagnosis. Once you're done with those steps, create a chart with all the success rates. We will use the same chart used in the previous question, listing the medication and their success rate. As you can see in the chart that BUP is the most successful medication for patients with a drug abuse diagnosis based on our data. Here's what your chart should look like, with the medications CIT, BUP, SER, VEN, CT, MIRT, and NTP, with the success rates to the right of them.